Hello everyone. Today we will be discussing about a special condition of the lower limbs that is known as varicose veins. It is a very common condition which affects a lot of people, but many of us are ignorant about the disease. So we shall be clarifying our doubts today via this video. First of all, what are varicose veins? For that we have to understand that there are two types of blood vessels in our body. First is the artery and second is the vein. This is our heart. Heart pumps out the blood, it goes to some other organ and it returns to the heart. The vessel, the blood vessel which takes the blood out of the heart to the organ is known as an artery, and the vessel which takes the blood from the organ to the heart is known as a vein. So that makes it pretty clear that we are dealing with the venous system of the lower limbs, which is a condition called varicose veins. Now to clarify it a bit further, होता क्या है कि this is our lower limb. There are two types of venous systems in the lower limb. दो टाइप की veins होती हैं. One is the deeper vein and one is the superficial vein. The deeper veins run close to the bones and right, whereas the superficial veins run close to the skin, and it goes and meets the deeper vein in somewhere near the thigh. So the varicose veins is the condition in which the superficial system, that is which is close to the skin, those veins are involved. We'll be discussing that why does varicose vein occur. It is usually seen in people who have long standing hours of jobs. For example, it is seen in traffic policemen, it is seen in surgeons, and it is also seen in females post pregnancy. What happens is, the people who keep on standing for long hours, the blood, it tends to get collected in the lower limbs. The blood, once it gets collected, there is a problem of it coming back towards the heart. वो हार्ट की तरफ वापस नहीं आता, इसलिए पैरों में स्वेलिंग होने लगती है, जिसकी वजह से जो टांग की नसें हैं, जिन्हें हम वेन्स कहते हैं, उनमें फुलावट या फिर उनमें सोजिश आ जाती है, जिसकी वजह से ये वेन्स हमें दिखने लगती हैं, और इसी प्रॉब्लम को हम वेरिकोज वेन्स कहते हैं. Now this problem has 6 stages, stage 1 to stage 6. Stage 1 is a very commonly seen problem, जिसमें हमें बिल्कुल ही छोटी छोटी, बिल्कुल ही महीन सी 1 या 2 mm की, रेड कलर की, ब्लू कलर की या ग्रीन कलर की छोटी छोटी नसें हमारी थाई के पीछे, थाई के ऊपर या हमारे काफ के पीछे हमें दिखने लग जाती हैं. These are called reticular veins. This is the stage 1. As we progress, फिर हमें वेरिकोसिटीज़ या फिर मोटी मोटी नीले रंग की या हरे रंग की नसें हमारी लेग्स पे दिखने लगती हैं. आफ्टर दैट द स्वेलिंग कम्स, फिर यहाँ पे ज़ख़म बन सकता है. टांगों का कलर जो है अराउंड द एंकल, इट चेंजेस फ्रॉम डार्क ब्राउन और इट माइट इवन टर्न ब्लैकिश इन अपीयरेंस. फिर वहाँ पे एक ज़ख़म या फिर अल्सर बन सकता है विच कैन ब्लीड, एंड व्हेन इट ब्लीड्स अ लॉट एंड दैट कैन एंड अप इन एन एमरजेंसी, एंड लेटर ऑन that ulcer becomes non-healing. That is the 6th stage of varicose vein disease. Usually we do not have many patients who come to us initially with in just stage 1 or stage 2 or stage 3 of disease, because the people are usually not very well aware of the problem. They become aware only when there is a lot of swelling or a lot of discoloration, that is कि जब टांगों में बहुत ज़्यादा सोजिश आने लग जाती है, या फिर टांगों का जो रंग है अराउंड द एंकल या जो टखने के आसपास का रंग है वो बदलने, स्किन का कलर बदलने लगता है. दैट इज स्टेज 3 और स्टेज 4 ऑफ द डिजीज़. इन स्टेज 1 और 2 ऑफ द डिजीज़ और इवन अप टू स्टेज 3 ऑफ द डिजीज़, we can manage these complaints conservatively for a small period of time, and it helps us in achieving a better result for the surgery. As we have just discussed कि एक हमारा deep venous system होता है और एक हमारा superficial venous system होता है. ये तो हम समझ गए हैं कि बिकॉज ऑफ द ग्रेविटी एंड कूलिंग डाउन ऑफ ब्लड इन द लोअर लिम्स कॉजेज स्ट्रेचिंग ऑफ दीज वेसल्स लीडिंग टू देयर डायलिटेशन एंड स्वेलिंग एंड अपीयरेंस ऑफ लार्ज वेरिकोज वेन्स ऑन द स्किन. लेकिन इसके अलावा और क्या कारण होते हैं? These veins the superficial veins also have one-way valves in them. तो अगर blood ऐसे ऊपर जाएगा और वापस नीचे नहीं आएगा, due to excessive stretching of these veins, these valves they do not function properly and the blood starts to come down. The second thing is कि इनका जो junction है यहाँ पे, इस पे this junction also becomes incompetent and the blood from the deeper veins it starts to come inside the superficial veins, and there is another communication in between the two veins which is called perforator veins. इनमें भी one way valve होता है from superficial to deep. These valves when they become incompetent, so the blood will start coming from deeper veins to superficial veins, therefore increasing the swelling of the superficial vein, therefore increasing the severity of the disease. Now coming to what are the treatment options we have for different stages of varicose veins. In the initial stages we can manage the patient conservatively with a few medications and asking the patient to go ahead with offloading या फिर to apply compression dressings or compression stockings on the lower limbs. This can only help to slow down the disease process. It generally does not cure the disease process. For a definitive cure we require a surgery. Initially in earlier times or in recent past, the treatment of cure was an open surgery in which whole of the superficial vein was taken out of the body and these perforators were ligated या फिर इनको suture कर दिया जाता था. But it used to be a very morbid surgery and there were some complications like bleeding or excessive pain or nerve injuries associated with this surgery. Now as the time has passed, in the recent years we have come up with a few novel techniques like RFAs, lasers and foam sclerotherapy. In Healing Hospital we deal with these conditions using the latest laser technique. In this what we do is we burn hole of this superficial vein using a laser fiber. And this can be done under local anesthesia. This is basically a daycare procedure where the patient comes in the morning, we do the surgery within half an hour to 45 minutes and the patient is good to go home after 2 to 3 hours of hospital stay. There is a very small incision, just a needle prick, and the surgery is done within 35 to 40 minutes. The advantages of laser in this condition particularly are that the patient does not require any anesthesia, that is any spinal anesthesia. The patient does not require 1 or 2 days hospital stay and the patient has a very short hospital stay. It is not associated with any bleeding and it is a painless procedure. The patient is good to go home after 2 to 3 hours of procedure. In our hospital we take care that when you are admitted to our hospital, to the time you are discharged from the hospital, we assign a special person to you. He is your own care buddy. He will take care of all the formalities during the hospital stay till the time of your discharge, making your stay a pleasant stay in the hospital. If you have any queries related to varicose veins or any lower limb related problems, you can visit me in my OPDs in Healing Hospital, Sector 34, Chandigarh. Thank you.